Welcome to the Scleroderma Association of BC's 38th Annual Conference. I'm Roseanne Queen, and I am the president of SABC. It is my pleasure to introduce Dr. Leslie Laing. In addition to being a clinical associate in the Department of Prosthodontics at the Faculty of Dentistry, University of Toronto, Dr. Laing holds the position of prosthodontist and dry mouth specialist at the Toronto Public Health Dental and Oral Care Clinics. She also has private practices in Toronto, Mississauga, and Brockville, and is devoted to implant and prosthodontic dentistry. At each of these practices, she's established the Sjögren Syndrome Dry Mouth Resource Centers and continues to conduct research projects in various aspects of Sjögren's and other causes of dry mouth. She has recently been awarded the Queen's Toronto Alumni Branch Tricolor Champion in 2020 and the Queen's University Alumni Association Humanitarian Award in 2022. She is honored to be the current president of the Sjögren Society of Canada. Her presentation is on management and treatment of the oral complications associated with dry mouth, and she's going to give us some tricks and tips. Over to you, Dr. Laing.
Thank you so much. Sorry, I did what everybody doesn't want to do. Okay, so let me get started. Oh, sorry, I forgot the share. Okay. There we go. Okay, thank you so much. This is a true delight to be here. This is quite amazing to be with your group. I'm quite thrilled about this. I just want to get that off. Okay, very good. So I'd like to start off by telling you a bit about what we plan to cover today. I'd like to look at the debilitation of the oral situation in both Sjögren's and scleroderma, and also mention a little bit about some other autoimmune diseases. We're going to look at the prosthodontic challenges in treating a patient with dry mouth, as well as various treatment strategies, both with traditional and non-traditional means, and look at some tips and tricks. So a prosthodontist, first of all, what is that? It's a dental specialist, also known as prosthetic dentistry, and we take care of missing teeth. We're also the ones who look after missing eyes, ears, and noses as well. So I would like to start off by introducing you to my Gordon setter, whose name was Dundee, and all I would have to do is to say treats, and saliva would flow. No matter what time of day, but I only if it was that easy in a dry mouth, but unfortunately it is not. Saliva has a yucky connotation, not only with whether you have too much of it, whether you have too little of it. Even some of its names that it goes by are also rather unflattering. And when I was looking up in Google to find a picture of saliva, I came across this rather grunge rock group from the Carolinas, and there's certainly nothing glamorous about these folks. And saliva, unfortunately, is not very glamorous either. But it does, however, have many beneficial attributes. Obviously, the first one is that it will prevent the dehydration of your mouth and keep the oral tissues all moist. But also it does that, and in addition, it will aid digestion. So as soon as you start eating crackers, the carbohydrate digestion will start in your mouth thanks to some of the enzymes that are in the saliva. Without saliva, you have difficulty tasting your food. Saliva will also help you speak properly and enunciate. It will prevent you from getting ulcerations from your soft tissues and stimulate the repair if there is a minor cut. And as a prosthodontist, of course, I should mention that it will help make wearing any kind of prosthesis a bit more comfortable, and also will aid in the retention. There are in the capability of saliva is to dilute the acids that are present in your mouth, especially if you ingest these, and it acts as a bit of a buffer. There are, sorry, I'm trying to, oh, finally got rid of that. Sorry, I was trying to get rid of something there. It will promote remineralization of the teeth. So for example, with some fluoride or your diet, and it will help to remineralize your teeth if these are becoming decayed. But in the words of Joni Mitchell, our true Canadian songster, you don't know what you've got till it's gone. And I should mention here that dry mouth is not the same as thirst. You could, if you are thirsty, you could drink a glass of water and that would satiate you. Whereas if you have dry mouth, a glass of water will not cease dry mouth. And in fact, because you're swallowing the saliva that you have, you may even find that your mouth is a bit drier after drinking the water. There are two terms used in medicine associated with dry mouth. One is the one you're probably familiar with, that of xerostomia, but it is the patient's perception that they have a dry mouth. May still have saliva. In fact, often the patient will tell me that their mouth is very dry, and yet I will see a pool of saliva in the floor of their mouth. It's a very fancy word, but it's the one that sounds more serious than hyposalivation. Hypo meaning small and referring to the amount of saliva that you produce. But if you truly do have a decrease in the amount of saliva, this is termed hyposalivation. So there quite often is a wrong use of the term xerostomia, which is the patient's perception of a dry mouth. All right, dry mouth then is associated with several different autoimmune diseases, including Sjögren's and scleroderma. It's also associated with patients who are undergoing neck cancer, either immunotherapy or radiation therapy. And I should mention that a lack of saliva is not the same from an autoimmune disease versus the head and neck cancer therapy. The quality is different and the quantity is different. And with a head and neck cancer patient, the amount of saliva may stop almost instantaneously, and it may restart, fortunately for the patient. Not always, but it will sometimes. There are over 500 medications that are commonly used that have a dry mouth as a side effect, such as heart medications, cholesterol medications, and antidepressives. And now that marijuana has been legalized, if smoking marijuana can also be associated with cotton mouth or dry mouth. Now, Sjögren's itself is a systemic autoimmune disease. Most obviously, it is associated with the infiltration of lymphocytes into some of the exocrine glands. These are glands that secrete some kind of liquid, whether it's in the form of tears, such as the lacrimal glands, or in the salivary glands. You have three pairs of major salivary glands. The first pair is the ones that are located in your cheeks, look something like a cooked cauliflower with a straw coming out of it. And these are the parotid glands, and they're responsible primarily for the aqueous or watery part of saliva. At the corner of your jaw, your lower jaw, are the submandibular glands, and they, in combination with the ones that are underneath your tongue, known as the sublingual glands, are responsible for the mucus part of saliva. There are also hundreds of minor salivary glands in your lips, called the labial glands, ones on the tongue called the lingual glands, as well as the ones on the palate, known as the palatal glands. All right, there's even a fourth pair of glands that have recently been identified by a Dutch group. And you might say, well, wait, why have we just learned about these ones? Well, they are smack dab in the middle of your skull. So if you open your mouth, you cannot see them. They are located just right in between your ears and in between your nose and the back of your head. This is a bird's eye view looking down, and you can see where they are located here. These, by the way, are the parotid, and these are the submandibular and the lingual overlapped here. But these would be the tubarial glands, and the location. Many of my patients tell me about postnasal drip. This may be the cause, but so stay tuned for some research upcoming that way. And it may be if we say ah, there is a difference between the hard palate and where the soft palate interface. And in some patients, you may actually see these two little openings here. And who knows that these fovea palatini, as they're called, may actually be the exit of the secretions from the tubarial glands. We'll see. So Sjögren's then is named in honor of the Swedish ophthalmologist who first identified this disease. And patients came to him complaining of dry eyes, and in his medical examination of these patients, they also made note of the fact that they had dry mouth, joint pain, as well as excessive fatigue. And he found 19 of patients who were all women, and he reported this in 1933. It was not considered a very serious disease or disorder at the time, but we've come a long way. And so next July 23rd, which is his birth date, will be the 14th annual World Sjögren's Day. Sjögren's has the hallmark features of dry eyes and dry mouth, as well as joint pain and excessive fatigue. Those are only 4 of the symptoms. There may be approximately 60 more of them. And in fact, it's very confusing because we even have patients who tear constantly and those who drool. We recently came out with a new brochure from the Sjögren Society of Canada, highlighting many of the more common. And you can see not only is it a disorder of dryness, but also there's brain fog, nosebleeds, liver abnormalities. There's a greater incidence of lymphomas, lung disorders, dry cough, reflux disorders as well, vaginal dryness, as well as peripheral neuropathy, tingling fingers and the toes, as well as around the mouth. Sjögren's primarily affects the postmenopausal women. There's a ratio of about 9 females to 1 man, but there is also a pediatric version of Sjögren's. And pity the poor boy who also has Sjögren's, because they are in a minority. Now, just looking at some statistics here, there are more individuals with Sjögren's than scleroderma, lupus, and multiple sclerosis combined, yet very few have heard of. And I'm very envious of the amount of money that you folks have raised for scleroderma. There are about 20,000 Canadians with scleroderma at last report, as far as I can tell. Lupus, about 50,000. Multiple sclerosis are about 90,000. And Sjögren's, however, is about 430,000, which is about 1% of the Canadian population. And recently on CBC, I heard another statistic about how many nurses there are in Canada. There are 400,000 nurses in Canada. So even we outnumber the nurses. So lots of patients, but very difficult and related to several challenges. One, of course, is how do you pronounce the name? Well, my apologies to anybody who is of Swedish origin, but we have anglicized the name to say Sjögren's. Sjögren's itself is not curable. It's not preventable. We can't delay its start. We can't prevent it at currently. It frequently goes unrecognized because the patients look perfectly well. And this is unrecognized not only in the medical community, but also in the dental community. It's often misdiagnosed, and the time for diagnosis can take even up to 10 years. Another challenge is how do we treat the dental decay? So is this a Sjögren's patient? Well, it actually is. And this patient was highlighted in a 1997 paper with respect to dental implants. And if all our Sjögren's patients had swelling of their parotid glands in their cheeks like this, as well as their submandibular glands here, this would be very easy to identify. But that's not the situation. Our patients look like this. or like this. This is our celebrity patient. This is Venus Williams. So they look perfectly fine and happy and healthy, and quite often they will be told, oh, they're dear, drink water. Well, that doesn't do much. Since 1965, there have actually been 13 different classification criteria that have been published with respect to Sjögren's, one of which didn't even include the mouth. We kind of take a back seat. This is the latest one that has been published, and it has 4 major criteria. If you have symptoms of Sjögren's, you may be asked to have a lip biopsy. This is what the minor salivary glands look like in the lower lip. If we take these out, they look something like little bubbles like this, and maybe anywhere from 1 to 4 millimeters in size. If we take these then and scan them and look at them under the microscope, you may see in a Sjögren's patient a congregation of many of the lymphocytes. And this area is known as a foci. And if there are more than one foci in an area of 4 square millimeters, then this is given a score of 3. Patients will also undergo various blood tests for looking for antibodies. And if they have antibodies to SSA, or what is known as the antigen rho, after one of our first patients, this is also given a weight of 3. Eye tests are done both with some staining to look at the surface of the eye, as well as the amount of tears that are secreted. And if there is, these two will also be given weights of 1. And then finally, the oral component, if we have less than 0.1 mils of saliva secreted per minute, that is given a weight of 1. So if you add up all the scores and get a total of at least 4, then this meets the criteria for primary Sjögren's. Now, an update here, I've been using the term Sjögren's, which is the familial one. It's also known as Sjögren's syndrome, or the non-possessive Sjögren syndrome. The Americans are now leaning towards the term of Sjögren's disease, because disease sounds more serious than syndrome. I also mentioned that it was previously classified as primary or secondary, meaning that if it was secondary, it did not take a back seat to another autoimmune disease. It just meant that you had an additional autoimmune disease. And this is being done away with because different diseases use these same terms, but they mean something different. The latest international symposium was in September in Rome. And I was the only Canadian there, which is a little bit embarrassing, but at least I flew the flag. So I am indeed the president of the Canadian Society of Canada, and here is our contact information. Let's look at some of the oral manifestations now with a low salivary flow rate. This was a patient who was a nurse who was referred to me, and you can see that, yes, there is indeed some saliva. You can see some of the bubbles here. Her gums are shiny, but you can see the beginning of the decay that is happening at the gum line. And you can see that there are slits in some of her teeth. She's had previous crowns placed, but as time went on, this is about 6 months later, you can see that the saliva is now becoming very ropey or very mucousy. Look at her lips, very, very dry. The teeth are breaking off with no pain to her. They're just crumbling. You can see the beginning of decay here. Time went on. Again, look at the dry lips. More teeth have broken off. And eventually, if we go from the beginning to another 6 months to here, this is actually where the tooth broke off that has this crown, and this is gutta perca from the root canal. To this, the teeth are splitting, and finally here, where the lower front teeth are all missing. To show you now some of the oral manifestations in scleroderma, there often is what's known as microstomia, or very severe limited mouth opening. The cheeks and can give a hardening, so it looks very stiff, thanks to the connective tissue that is here. Often the mouth will be able to close, and so there is an anterior opening, and the front teeth will become visible, I should say. The tongue may be very stiff, There's also more periodontal disease in scleroderma than there is in Sjögren's, but the fact that there is less saliva in the mouth makes it very difficult to not only chew, but also to swallow. And there's an increased incidence of GERD or GORD, depending on how you spell it, but with digestive problems. This was a paper that came out from the Sjögren's Syndrome Foundation in the United States, promoting the use of fluoride for caries management. And while fluoride has been very good with respect to remineralization of the teeth, the evidence in this paper is lacking. There are only 2 papers that are cited, and even those are rather dubious. But remember that the fluoride is not there to have an antibacterial effect. It is only there for a remineralization of the teeth that have already started to break down. And I can confirm this when I have patients who have been referred to me who tell me that they are on highly fluoridated rinses on a daily basis, that they use concentrated fluoride paste in specialized tray as well as a daily basis, and that they get every 3 to 4 months fluoride varnishes applied to their teeth from their dentist, and their teeth are still crumbling and they still have rampant decay. But that's because the bacteria are still present. So food for thought. Let's go backwards a little bit now. Hippocrates is known as the father of medicine, who way back in before BC was discussing the use of silver in wound care. The use of silver in dentistry goes back to 659 in China, where it was used for its antimicrobial effects. And in fact, if you think about your silver fillings, they are silver because they contain silver, not because they contain mercury, which also happens to be silver, but they have lasted longer than your white fillings have, undoubtedly. There is a material now that has recently become licensed in Canada, just in 2018, that was studied in San Francisco. Its name is Advantage Arrest, and it's the product of silver diamine fluoride. Only dentists can apply this to you, but it was studied in San Francisco, and it was looking at the antibacterial effects of silver. Silver will be incorporated into the bacterial cell and will prevent its replication, causing that bacterial cell to die. The SDF, it comes in a formulation of 38% silver diamine fluoride, of which 25% is silver, and it's the antimicrobial part. There's also 5% fluoride, which once the bacteria have been killed, will now allow the fluoride to undergo the remineralization of the teeth. Remember that dental caries or cavities is a bacterial infection. So in order to prevent caries, we must get rid of the bacteria. And in the past, dentists were known for their drilling capabilities, and we would try to drill out the cavities. But even if one bacterial cell is present, that can divide and conquer and give more of the decay. So now we're looking more at the medical model, which is suggesting the use of the antimicrobial agents as well as fluoride therapy. And the indications for use of this silver diamine fluoride are for extreme caries risk. So here's that term again, xerostomia. It should actually be hyposalivation, but it's for the dry mouth patient as well as these children who have early severe childhood caries. And if you look very quickly here at this patient's lower back right side, you will see that there is a silver filling here. There's some decay here on the premolar as well as here. If we, as dentists, poke around in these areas, we will find that these areas are very soft. So this SDF was applied to the molar as well as to this premolar. And you can see that this is beginning to turn black. And the SDF only stains the decayed areas black. So this is decayed. This was the control tooth. You can see here where the decayed was not stained. But after a week, this area is hard, whereas this one is soft. So this is showing you that even within a week, the remineralization can take place. This is what severe early childhood caries looks like after SDF treatment. You can see this is the decayed area, and it will occur at the gum line. This is on the inside. You can see some here where there's on the biting surface of the teeth. And you may say, okay, why is she talking about severe early childhood caries? Well, we did a study, that's me, did a study on the microbes associated with Sjögren's, and we found that there were 4 new species of bacteria, because it didn't make sense to me that the same bacteria that causes decay in a wet mouth would cause it in a dry mouth. And it turns out that one of these bugs happens to be the same one that causes the severe early childhood caries. The location of the decay is at the same place, at the gum line and on the smooth surfaces of the teeth, which again is different in a wet mouth. So we did a study of once this product was available in Canada on 80 Sjögren's patients. In fact, there have been more now participated. We painted this on their teeth, and you can see where the decay is noted. But within a week, these areas would be hard. Now, are you going to say that I don't want to go out with something looking like that? Well, no, I would never have a patient leave my office like that. But we know that the staining will occur very quickly, and then we could cover this up with the white filling material for aesthetic reasons. But their sensitivity issues disappeared, and the lesions would be hardened within a week. You can undergo, for example, if this is some of the SDF staining, we can apply the white fillings that look like this. So it doesn't require any anesthetics, no drilling. We might do a bit of polishing, but it is minimally invasive treatment. So it's highly effective in arresting the decay. This is just an example of, again, another autoimmune disease of graft versus host. You can see the decay, again, similar to what it is in Sjögren's. Painting the teeth on, you said, oh, that's awful. Well, again, with a little bit of treatment here with some white fillings, you can get something like this. Obviously, these have not been treated yet, but just to show you what we can do. Minimally invasive dentistry that is usually covered by insurance. Now, one thing, now I'm going to move along from the implant part because I would like to get to my 10 tips and tricks. And if you have questions about implant therapy, I will go back on to that. Let's start here because I think this is what you might find most beneficial. All right, number 1, massages. So here's an example of the parotid gland, which is in your cheek, and here's the duct or the straw through which the saliva will come. And if you massage your cheeks with your fingers in a forward direction, this will help stimulate the saliva release that may get caught in times in this duct. Sometimes you may have saliva stones, and that will be blocking this duct. So massage forward. If you put your tongue down to the bottom of the floor of your mouth, you will feel 2 soft pillows. These are the sublingual glands. And if you take your tongue and rub it back and forth along these glands in what I call the oral kegels, for you ladies listening, you can do this with nobody looking, but it will also stimulate some saliva. Now, you can also use some physical means, a mechanical stimulation by sucking on either lozenges or using some gum. But please make sure that these are aspartame free, because that sugar-free substitute will cause even more drying of the mouth. Xylitol has been shown to actually decrease one of the decay-causing bacteria called Strep mutans, and this is very good, but limit your amount of xylitol that you take in one day, because there are some side effects with stomach troubles. If you don't like wanting to use gum or candies, in effect, you can also put in something else, like a cherry pit. You can use a plastic button. You can even use a pebble. And just the fact that it is being stored in your mouth and moved around by your tongue can stimulate some saliva. And you say, why am I using a pebble? Well, there have been stories that the American Indians would ride horseback across the deserts and keep a pebble in their mouth, and this would actually stimulate saliva. So there you go. And have it relatively big enough that you can keep it in your mouth, but small enough that if you swallow it, it's not going to cause any problems with your digestive system. There's another type of candy aid that was developed by a dentist known as Dr. John. And of course, when I was first introduced to this, it was a prosthodontist actually at a symposium in Philadelphia, and he came running up to me after my presentation, and he said, Leslie, have you ever heard of Dr. John's candy? Well, I, being the Canadian, of course, only heard John and candy, thinking that it was, oh, of course, I've heard of John candy. And he said, no. This is a special lollipop. And there's another version known as Lola's with Cava block. And both of these contain licorice root extract, which has been used for thousands of years. It is a sweetener, but these lollipops, in a study that we did, as well as some other folks, that it did cause a reduction in strep mutans in the mouth. And all you do is to eat these twice a day for 10 days, and it decreases the amount of strep mutans for up to 6 months. Licorice root extract has many beneficial effects also in autoimmune diseases, including Crohn's, lupus, scleroderma, and rheumatoid arthritis, as well as effects, as I mentioned, in decreasing the caries. Another form of, again, something medicinal or pseudo medicinal that you wouldn't think, is drinking green tea. Well, green tea has a lot of phytochemicals in it and catechins, and we did a study with the green tea. Note in the past that that green tea can reduce the amount of dental cavities, as well as some of these other diseases, improving our immune response. So we did a study with the patients, both Sjögren's patients as well as non-Sjögren's participants, and we found that it clinically increased the amount of saliva that was released by the Sjögren's patients. We did a study as well with a mechanical engineer and found that the viscosity or the thickness of the saliva decreased by 50 to 60%. In other words, that mozzarella likeness on French onion soup analogy has been decreased. The other thing about drinking green tea is that you can hold the mug against your cheeks, acting as a warm compress. Obviously, don't do this if it's boiling hot. All right, a little bit of a myth. Quite often you are told to drink water, but remember that water does not stay in the mouth. In other words, it's not substantive. And when you drink the water, you swallow the saliva as well as the water. And patients have told me that their mouth is actually a bit drier after they swallow. Ice chips, of course, will stay a bit longer, but keep yourself obviously hydrated, but don't overdo it. Now, I wouldn't be a prosthodontist if I didn't refer to some kind of removable prosthetic work. So the fact that one of the things that we tell our patients as soon as we give them a denture that they've never had before is that they will salivate. And the reason being is that in your gums and lips are minor salivary glands. And the fact that there is something mechanical sitting on the gums will stimulate some saliva. Even a night guard, or you can wear this in the day, will cause, as long as it's touching the gums, you can get some saliva released. Now, sometimes if you do not have much saliva, you can even put a little bit of coconut oil in the denture, and this will act as the form of mucousy saliva and increase the retention and the comfortability. So while I'm talking about coconut oil, we did a study on oil pulling with coconut oil. And again, this is a technique that has been around for thousands of years, traditionally used with sunflower oil, sesame oil, and now with also coconut oil. And we found that by having the patients do the oil pulling for 3 weeks, where I collected the saliva, the tongue scraping samples, as well as plaque around their teeth, we found that the bacteria strep mutans decreased by 100-fold. In other words, went from 1 million counts down to 10,000, which is remarkable just by swishing. The yeast, which is common in a dry mouth, also went down 100-fold. Now, mind you, it didn't do this overnight, but it did it over a 3-week period. The lactobacilli are both friendly as well as detrimental. It had very little effect on lactobacilli, but what I should mention here is that many of you may have been prescribed chlorhexidine. We included this in the study, but only for 2 weeks because it stains the teeth. It also stings the gums. I do not like this product particularly, but on a short-term basis, it's not bad. But look, it even killed the good bacteria. Not the best antiseptic. But the comments from the patients, my gums don't bleed after I floss anymore. I can taste again. My teeth look brighter. They don't have that dull coating anymore. And they don't have the sourdough smell anymore. Sourdough being from the yeast. There are several commercially available moisturizing products on the market. One of them that you may be familiar with doesn't work as well as it might. And in fact, one of them has a very low pH. This is the pH of 5 is very acidic. And can start to cause root decay. This is another product. 3 is the pH of lemons. So I suggest that you think of lemons. Don't suck on lemons. It will definitely stimulate saliva, but think of lemons. And the products that I would like to mention, the moisturizing ones are, this is a group of products that was developed by somebody who actually used to work for the Biotine company. It's called Bio Extra. And all the enzymes and active ingredients were put back in the product. This is available through, or online, I should say, as well as through Amazon. There's another one called Plaque HD, which has tea tree oil in it and was developed for the head and neck cancer patients. Xylamelts are very good. These are discs that you put on at the back of your upper mouth at nighttime to keep your mouth a bit moist when you sleep. Lubricity is a spray that you spray at the back of your throat, not on your tongue, but at the back of your throat, and has hyaluronic acid in it, as well as 4 other natural ingredients, but is very effective in moisturizing your mouth. You can even use just plain water in an atomizer. For remineralizing, you can have these very high fluoride containing toothpaste, Prevalent 5000. There's a 3M version as well. But remember, these are for remineralization of the teeth. They're not antibacterial. There are highly fluoridated rinses and even toothpaste, which this Remin does not have the foaming agent, which is there for it was a marketing agent to say how well it works, but it can also dry out your mouth. So these are very good. So I would just like to conclude then that both Sjögren's as well as scleroderma are both very serious systemic diseases and have very severe oral consequences. Please ask your dentist about the application of SDF. It takes 2 minutes. Yes, it has a bit of a silver flavoring in it, but that leaves by the time you leave the office. It can stain, yes, but that we have ways to counteract that. And with minimal invasion, inexpensive treatment, you can get aesthetic results and finally help you restore your self-esteem and giving you an optimistic oral future. So I would like to thank you very much. This is what we all dream for. And this is the way to contact me or the Sjögren Society of Canada. So thank you so much. Are there any questions?
Yeah, Leslie, there's a couple questions in the chat, and if you want to stop sharing your screen, we can restart your video so that we can have that improved. And Patrick's going to bring questions forward from the chat to you.
Yes, thank you, Doctor. There's about 4 questions I got. A couple of the questions are directly to me, so others might not be able to see them on that. But I'll kind of go through the ones that I will receive.
Yep.
Get back in here. Okay. My dentist has not been able to address dental procedures such as caps, extraction, etc., due to my mouth size tightness. I've been getting by, but now I've had to fight infection, and my dentist wants to refer me to an oral surgeon. I'm wondering what an oral surgeon can do in getting it covered by medical insurance.
All right. So a specialized oral surgeon will be able to probably have an anesthetist as well. which a general dentist may not be able to do. And so we'll be able to maneuver your mouth and get the teeth that need to be extracted. Okay, wait, start my video. There we go. Okay. It should be able to use the instruments to extract any teeth that need to be extracted under more optimal conditions than a general dentist could do. Yes, I realize that the mouth opening is limited in a scleroderma patient, but that again is another reason why I would suggest use of the SDF, the silver diamine fluoride. Please ask your dentist about this. It is very inexpensive. I know in Ontario, it's about $65. And it lasts about 6 months, but at least it will stop the bacteria. It will decrease the sensitivity. We used it throughout COVID on our long-term care patients at Toronto Public Health. It's amazing how it works because we didn't need to drill.
Okay, thank you. Next question. My dental hygienist stated that the only causes of dry mouth are medications or Sjögren's. I brought this information to my doctor. It turns out that I have lupus and non-Hodgkin's lymphoma. Can lupus also cause dry mouth in the absence of Sjögren's, scleroderma, or medications? And just a PS, my blood tests were negative for Sjögren's and scleroderma, positive for lupus, but I've had dry mouth for decades and use chapstick on all day long.
Okay, 15 minutes before this presentation, I just gave a talk to Lupus Ontario. So yes, indeed, lupus patients can have dry mouth. Now, they can also have periodontal disease, which Sjögren's patients tend not to do, at least not quite as much. Also in the lupus patient, there will be areas on your hard palate of redness that may be interspersed with white patches. You may also get striped areas on the inside of your cheeks, known as striations or like white stripes. That again is associated more with lupus than it is with scleroderma, but both scleroderma and lupus have more incidences of periodontal disease than Sjögren's does. Please, if you can go to Sjögren's support group or contact me, we can send you brochures to give to your hygienist. But certainly we've sent brochures out to all the rheumatologists in Canada. So your rheumatologist should have our brochures, but please, if you need any information for your hygienist, because that hygienist is incorrect in the information. But definitely lupus can cause dry mouth as scleroderma can as well.
Thank you. This is a question from one of our support group members. I've had to make a number of, or I've had to have a number of teeth removed due to loosening. Typically, have others had to do this as well?
Sorry, what was the very last part?
Oh, have others had to have their teeth removed as well due to loosening?
Yes. Now, the loosening would also be more related to the periodontal disease associated with scleroderma or lupus. But sometimes I notice that dentists are very quick to remove the teeth. Again, in public health, that's all I saw. I've inserted now 297 dentures in low-income seniors just in the last 2 years. And I will try to hang on to teeth, but I do the SDF treatment. And that certainly will give them a better outlook as far as the bacterial prognosis is concerned. Sorry, the first part of yes, many people have, because of the dental decay, sometimes it feels like a losing battle that the dentist keeps restoring the teeth with like the white fillings. The white fillings don't last as well as the silver fillings do, but they're more aesthetic. And so that's why we tend to use the white fillings more. In fact, probably some of you even had the silver fillings removed because they look so awful. Well, who sees the back of your mouth? Nobody. My silver fillings are still there from when I was a kid. So they last. The trouble with crowns, though, again, if your teeth are badly deteriorated, is that the only part of the tooth that is exposed is right at the gum line, and it's the area where the decay occurs. So be careful if your dentist is suggesting that let's just cut these teeth down and put in a crown, because it may not help matters, because again, it's keeping exposed the only part of the tooth that is affected by the decay associated with dry mouth.
Okay. We just got 3 more questions here. I'm scheduling for 2 dental implants to carry a 5. I'm scheduled for 2 dental implants to carry a 5-tooth bridge to replace a current 3-tooth bridge plus 2 decayed teeth. My dentist says there is no particular issue for a scleroderma patient to have a dental implant. In your experience, is this an accurate prognosis?
No. Thank you for that. So that's the part that I did skip over. I will give you my my slides. There was a paper just last year looking at medically compromised individuals, and they looked at Sjögren's patients, scleroderma patients, and lupus. And they said all you really needed to make sure is that the patient undergoes antibiotic prophylaxis. In other words, make sure you have antibiotics ahead of time, that there may be a bit more of what's known as peri-implant disease. Peri is the prefix for meaning around an implant. And they said the patient must have proper oral hygiene. Well, first of all, I would suggest that the patient who asked the question, 2 implants for a 5-tooth bridge or 5-unit bridge is stretching it. There is one of our studies looked at the amount of bone loss around implants. And many of these studies that say, yes, Sjögren's patients or scleroderma or lupus patients are fine to go ahead with implant therapy. And they say, look, the implants survive after 5-10 years, but survival is different than what we classify as a prosthodontist of what is success. And our success is less than 0.2 millimeters of bone loss per year after the first year of being in function, or loading as we call it. And I did a study of 20 some Sjögren's patients in comparison to 3 times as many normal healthy patients, and just looked at their x-rays associated with the implant therapy, and the implants had to be in function for at least 2 years. And the success rate in the Sjögren's patient was 59%. The success rate in the healthy control patient was 95%. So be careful that with your dentist that yes, you can get very good dental implants placed, but you may get more bone loss. So you may even want to have an extra implant placed just in case, and it's just to, you can even make it sleep, as we call it.
I think everybody's going to want to have you as their dentist.
Come. I'll be there.
A couple more. How do you use coconut oil pulling?
Okay. It looks like lard in a jar. And it shouldn't be actually called oil, but in the tropics where it comes from, it is liquid at room temperature. But when it's at 25 degrees or lower, it becomes a solid. So if you take half a teaspoon, put it in your mouth, the first time you do it, you're going to go, yuck, because it's oily. But once the heat of your mouth, of your body, melts it, swish it around. And the term oil pulling came about because you would pull and push it through your teeth, which in English is swish. So just swish it around. And originally the technique was to do this for 15 minutes on an empty stomach first thing in the morning. And that's actually what my study involved. But it's hard to do that. It's hard on your muscles in here. And then I realized, well, wait, why are we doing this for 15 minutes? Because it's picking up bacteria, plaque, yeast. So don't do it for 15 minutes because it's dirty oil. Spit it out, start again. You know, I did it for 15 minutes initially. But hey, I live with my dogs. They didn't mind if I didn't talk to them, but spit it out. Do it for a minute or so. If you want to do it for the 15 minutes, fine, but start with clean stuff. And you can do this as often as you like. You can put coconut oil on your lips. I've even had a special lip balm made with coconut oil, beeswax, soy oil, vitamin E in it. And I use it as my calling card, as a matter of fact. If you would like some, please let me know. You have to donate, though, to the Sjögren Society of Canada. But it is very effective. Some of these other lip balms have too much wax in them. Petroleum, Vaseline doesn't seem to cut it. Of my lip balms, I had 1,000 made. Only one said she liked Vaseline better. But remember, Vaseline is petroleum products. So that's how you oil pull. It's very easy to do, and especially right before you go to bed at night.
Can we assume dentists know about STF?
Good question. So, well, they ought to, because it has now been licensed in Canada since 2018. But, you know, even at the University of Toronto, I was so gung-ho after I had done the study on the Sjögren's patient to bring it into our clinic. And the head of the restorative department said, no, you can't, because it's only for children. And I said, oh, come on, give me a break. So it was the proverbial pulling teeth scenario to get him convinced. So not all dentists are aware of it. It's been in all our journals, our Canadian Dental Association journal. I assume there's an equivalent with BC, but it's inexpensive. And there goes the financial draw point or drawing card of having fillings put in. You know, if it only costs $65 for a 15-minute treatment, it's going to take a long time for the dentist to recoup that. So, you know, and because it's not under the federal government, well, actually, technically it is right now, you know, they want to do all what they've been trained to do. And that's why I say the drilling is not going to get rid of the bacteria.
Okay. And we do have one other question, Timmy. Should we, as connective tissue patients, use antibiotics for cleaning? The concern I have is possible recurrent C. difficile with this antibiotic use.
Well, okay, I'm a little concerned antibiotics for cleaning, maybe once in a while, but as soon as you use an antibiotic, now that increases the chances of having an overgrowth of the yeast. And the yeast is almost harder to get rid of because you swallow it. And I have a theory that once it gets into your stomach, and it loves the acidity of the stomach, which is even less than lemons, it grows crazily over there. And here's your body trying to fight that. And that could be one of the reasons why you have excessive fatigue, because your body's overwhelmed with trying to get rid of the yeast. So I would try not to use antibiotics on a regular basis. I would ask your doctor, like, why are you using these? But I would try to limit them.
All right.
But I agree with the C. difficile problem. Yes, most definitely.
Okay, well, thank you. I think that's all the questions that we have. I think we're going to turn. Thank you very much. I found this very informative today.
Oh, thank you so much. Yeah, delighted. Thank you again.
That was extremely informative. I was so busy trying to write the 10 tips and get the names of all that information. So I'm really glad it's going to be recorded. Dr. Laing, if you can actually, if you have something in writing for the 10 tips, that would be lovely, because I couldn't actually keep up. Really appreciate your time. Yeah, the research that you're doing is great. And I think for me, I didn't realize the extent of how Sjögren's is affecting me. Like, I have the dry mouth, I have all this stuff, but I'm also having the other issues. And if I'm having the other issues, I think we can bet that everybody else is. So thank you so much. Really appreciate your time.
Oh, my pleasure. And just one quick word, coconut oil can be used vaginally.
There you go.
Okay.
That's important.
Note to end on.
Okay, thank you very much.
My pleasure. Thank you.